Hi guys, we'll be starting about one more very important discussion that is called animal irritant. Right? Animal irritant. We had discussed about plant irritant. Now we'll be discussing on animal irritant. So this is indeed a very important topic because you know the magnitude of the case of animal irritant in India. We'll be discussing on that. See, there are two types of cases that we get here. Number one, it can be due to bite or it can be due to sting. Right, when it is due to bite, you can say it can be, it's not human bite, right? We're not talking about human bite. It is about snake bite, it is about spider bite. Fine. And it is sting, right? It can be a scorpion sting, it can be honeybees, but scorpion is more important. Okay, so let's talk in detail about snake bite. This is quite very important. Okay, so why should we learn about snake bite? If you see the magnitude of snake bite cases in India, right, throughout the year you can see around 1.25 lakh cases of death occurring throughout the world. But out of that 1.2 lakh cases of death throughout the world, about 64,000 of death due to snake bite cases occurs only and only in India. Okay, so you can assess the amount of cases that we get in India. You can see the magnitude of the death of snake bite cases in India. Right, so you need to have a detailed knowledge about this particular snake bite cases so that you will effectively manage the snake bite cases at even the primary, at the different level that you can manage, different level of healthcare that you can manage. Right, fine. So let's have something little lighter. Okay, what are the interesting myth and facts that you know about snake? The snakes do drink milk. Is it true that snake drink milk? Snake do drink water. Snake does not drink milk. Snake can't even digest milk. Okay, so this is actually a myth. Flying snakes can pierce through your eyes, right? There is no flying snake. There are snakes which can glide, and there is no flying snake that will pierce to the eye. It will take off the blood. It will suck your brain. Nothing like that. That is also a myth. You can see this is a python, right? Python and boa constrictors kill the prey by breaking the bones. It's not by breaking the bones. They encircle the prey. It will constrict the body so that the person is not able to breathe. Right? The person is not able to breathe. It will cause respiratory paralysis. The person will die. Okay? So it's not by breaking the bones. Snakes do not have ears. Partially true, partially untrue. That is because snakes do not have external ears, but they do have internal ears, so that it will have bone conduction. Whatever vibration that is occurring on the ground, it can have it directly on the inner ears. That is the reason why always you can see the majority of the part of snake body will be in touch with the ground. Okay, so the nature has made the body like that so that it will have a lot of conduction in the inner ear. Snakes are poisonous. Right? Is it correct? The word is it correct to use the word poisonous? Ideally, we should not use the word poisonous. We should use the word venomous. What is a big deal? What is a big deal? See, basically speaking, even though venom is actually a part of it's a type of poison, but still there is a gross difference between the word poison and the venom. Poison is something where you ingest and you have signs and symptoms. Venom is something, it will produce symptoms only when it is injected. Right? When you ingest, it will not produce any signs and symptoms. Right? When the snake is biting you, it is injecting the venom, you get symptom that is called envenomation. Right? When you bite the snake, you get all the signs and symptom that is called poisonous. That is not venomous. So basically know the technical difference between the word venomous and the poisonous. Right? You see people biting the snake and all for taking revenge. Right? You see this is one case which was recently done, and you see this fellow survived but the snake died. Okay, so all these things do happen. But when you talk about the venomous snake, see, most of the snakes are non-venomous. That is most important to remember. Mostly they are non-venomous. Right? Only few snakes are venomous. But if you take India, out of the snakes which are available, 52 species of snakes are venomous. Right? Though you have 330 species of snakes totally, this 52 species of snakes alone are venomous. Right? So basically, most of the snakes are non-venomous. So that is very important to remember. Right? If you kill a snake, the partner will come after you. Right? Partner will come after you. It will kill you. right? All this is only myth. It is all we can see only in the movies, right? For the snake to remember, for the snake to have that kind of memory, that kind of intelligence, it should have a big brain, right? So that is not technically possible, right? That is all myth. Snake bites can be cured with traditional medicine. This is very, very important, right? Most of the times people in the rural area, they think that the snake bite cases can be treated only with the traditional medicine. It is a big mistake, right? Most of the time people come delayed with the delayed presentation to the hospital, where the person will be in a very terminal stage of envenomation. It's very difficult to manage a case of snake bite. You have to, right, you need to know that the snake bite cases cannot, snake bite envenomation can never be cured with the traditional medicine, provided if it is a venomous snake, right? Most of the times what happened, the traditional healers and all, they used to say that I will treat the snake bite, all snake bite cases with this traditional medicine. But what happens, most of the bites will be non-venomous bite. Obviously, whether you treat the person or not, obviously the person will be recovering, right? But what happens if it is venomous snake and you directly go to this traditional medicine, it will be counterproductive. It will endanger the life of the victim. So you have to be very careful. You make sure that you increase the awareness of this, particularly among the patients that you come across. Fine, right? So let's talk about the difference between venomous and non-venomous. Just now I told you most of the snakes are non-venomous. We will just try to find out how to differentiate between a venomous snake and a non-venomous snake by the appearance. Let's talk about that. Let us say this group belongs to venomous and this group belongs to non-venomous. This group belongs to non-venomous. Okay, let us start with the head. These snakes are basically scaly creatures. They are scary, we do know, but they are also scaly creatures. It has got scales throughout the body. Let us start with the head scales. Let's start with the head scales. See, most of the venomous snakes will have smaller head scales, and non-venomous snakes will have larger head scales. Larger head scales, right? If you look at the snake head, you can see, right? You can see this is the head of the snake. You can see the head scales will be small. Head scales will be smaller. But if you see non-venomous snake, this is the head of the snake. You can see that this is the head of the non-venomous snake, wherein the head scales will be much larger. You can see it is big snake scales. Right? So there's the basic difference between a venomous snake and a non-venomous snake. Smaller head scales in venomous, larger head scales in non-venomous. But don't get carried away by only this particular point, because there are few exceptions. You should not get carried away with it. What are the two important exceptions? Number one, it is cobra. Number two, it is crate. Cobra and crate will have larger head scales. You know very well, cobra and crate, they are venomous. But still they have larger head scales. Then how to identify whether it is cobra or whether it is crate? Let us say if it is cobra, right? So let us say this is the cobra, right? This is the cobra and this is the head of the eye of the snake, right? Let's have it, right? You look at the head of the snake, cobra. You're talking about cobra. You can see the head scales. Number 1, number 2, number 3. The third supralabial scale will be the largest. It will be touching the nostril and the eye shield, right? So this is the third supralabial scale will be the largest and it is touching the eye. What you have to know is the third supralabial scale will be the largest, right? That's why I've just drawn this. This is 1, 2 and 3. Third supralabial will be largest if it is cobra, right? What about crate? Crate, here we are not seeing the supralabial, we are seeing the infralabial. Let us say this is the crate. Crate is basically, it is jet black, right? So this is black. In the middle, you can see the median scale. So forget about that. Then you have 1, 2, 3. The fourth infralabial scale will be the largest. Right? The fourth infralabial scale will be the largest, that is seen with crate. The third supralabial will be the largest in cobra, whereas the fourth infralabial will be the largest in crate. So just do know the difference between this particular cobra and crate. We have discussed about the head scales. Now let's talk about the belly scales. Let's talk about belly scales. Right? When you say the belly of the snake, let us say this is the snake. We are looking at the ventral surface, the belly of the snake. right? The venomous snake will be having larger belly scale, which is covering the entire breadth of the belly, whereas if it is non-venomous snake, there can be larger its belly scale, but it will not be covering the entire breadth of the belly, or you will have smaller belly scales, either this one or that one, right? Something like that. If you have the larger belly scales covering the entire breadth, it has to be a venomous. That's how you need to identify, right? The next one is the tail. Look at the tail of the snake. The tail of the snake, it is compressed in venomous, it is not compressed in non-venomous, right? It is compressed in venomous, it is not compressed in non-venomous, right? Sometimes it is compressed, sometimes it can also be flat, particularly if it is sea snake, right? It is compressed in venomous snake. If it is flat, it is sea snake, and it is venomous. Look at the mouth of the snake. If you are looking at the mouth of the snake, you can see the presence of two fangs in the venomous snake. Two fangs, right? And in case of non-venomous, you are not able to see the fangs. Instead, you will see the small multiple teeth will be noted. They are just teeth. They are not fangs. Fangs are basically the modified canine, right? So they are basically the fangs. And if it is cobra, remember, in cobra the fangs are short and fixed. You can say it's grooved. Whereas if it is viper, it is such a long fang. Not only that, it is canalized. That is most important. It is exactly like, see, the viper is having the most sophisticated venomous delivery system. It has the venomous delivery system of viper. It is so advanced that it is exactly like a canal, like a muscular needle, intramuscular needle, right? So you can say this is like a needle. It is canalized. Fine, right? So that is about viper, and it has got one more important feature, unique feature of viper fang. It is hinged. What do you mean by that? It is foldable, right? It is foldable. It can fold it. Hinged fangs will be seen with viper, right? Now, if it is bites of venomous snake, you don't see a bite mark. Instead, you see a fang mark. This is the fang mark. Two punctured marks will be noted. Whereas if it is non-venomous, you don't see a fang mark. Instead, you will see a bite mark. There is a difference between fang mark and the bite mark, right? Then what about the habits? If it is venomous snakes are usually nocturnal, right? I'm talking usually. It can come in the daytime also sometimes, but usually it is nocturnal. But non-venomous snakes are not so. They are diurnal. There is no specific prediction for the time, right? They are basically diurnal, whereas venomous snake, they usually are nocturnal. So these are the important difference by which you can differentiate a venomous snake from a non-venomous snake. You can see the head scales, you can see the belly scales, the tail, the fang mark, and the habit. So by which you can identify whether it's a venomous snake or a non-venomous snake. Right? If you want to have a look at it, you can see that this is a venomous snake, that is a non-venomous snake. You can see venomous snake, it has got long fangs, right? Non-venomous snake, it has got only teeth. Number one, you can see head scales are smaller in venomous, head scales are larger in non-venomous, right? You can see this is the belly scales, right? This is a venomous snake belly, this is non-venomous snake belly. You can see the large belly scale covering the entire breadth of the belly in case of a venomous one. Right. After identifying that it is venomous, the next step is to identify which family does it belong to. This is again important because the toxicity of the venom, right, you can identify from the type of snake and the family that it belongs to, right? So you need to have some idea about the family of the snakes, right? You have lot of families, right? Colubridae, Crotalidae, Atractispidae, so many families are there, but we are not concerned about all the important families, right? We are not concerned about all the available families of the snake. We are concerned about the three most important families that is present in India, that is relevant in India. Number one, we have the first family that is called Elapidae, elapid snake, right? The venom of most of the snakes are predominantly neurotoxic. Underline this, make a note of this. This is so very important. Elapidae. The next family is Viperidae. Wherein the venom of most of the snakes are predominantly, they are hemotoxic. Exceptions can be there. Russell's viper, they have hemotoxic nature. It has also got neurotoxic nature as well, but predominantly it is hemotoxic, right? The third thing that you have to know is called hydropidae, or you can say hydropinae. The hydropinae is actually a subgroup of Elapidae. It is a subgroup of Elapidae family, whereas the venom of this particular snakes will be myotoxic, right? They are myotoxic. Fine. So it will cause myolysis, myonecrosis, patient will end up with renal failure. So that is a basic understanding that you need to have. When a venom is neurotoxic, it can cause neuroparalysis. When the venom is hemotoxic, it can cause hemotoxicity, right? When it is hemotoxic, it can cause bleeding tendencies. When it is myotoxic, remember, it can cause muscle fiber necrosis, myolysis will be there, myonecrosis will be there, patient can present with renal failure as well, right? So these are the broad idea that you need to have. I've told you the three important families. After learning about the three important families, you should also know what are the important snakes present in this family, right? Elapidae, the most important snake is king cobra, right? The king is there in the family, right? King is there in Elapid. Fine. And then you also have common cobra in Elapidae, common cobra. King is there, common cobra is also there, and we also have crate, common crate. Fine. You don't have only these three snakes in this family. You have lot more snakes in the even the mamba comes under Elapidae. But we are not talking about all the snakes available in this family. We are restricting our discussion only towards the snake present in India, which are relevant for India. Remember, Elapidae means only three snakes that you have to remember. Number one, it is king cobra. Number two, it is common cobra. Number three, it is crate. Okay, coming to viperidae. When I say viperidae, underline the word viper, so it contains all vipers. It contains all vipers that you need to remember. Here we will be talking about what is called as Russell's viper. Russell's viper. Right? We also have saw-scaled viper. We also have saw-scaled viper. There is one more viper case now. It is increasing nowadays. That is called hump-nose viper. Right? So we have Russell's viper, saw-scale viper, hunt-nose viper. All these are vipers. All of the vipers will be in this family. Right? But these vipers are important for us. When I say hydropinae, what you have to remember is it is about sea snake. All the sea snakes bites are venomous. Okay? Fine. So these are the important snakes with regard to Indian scenario. Fine. Now what happens though you have all the snakes available in India, which are relevant in India, common in India, but only these four snakes are very important, right? We call it as big four. Why it is called as big four? Because these are the four snakes which are present throughout the country, and most of the cases of snake bite in India are primarily due to any one of these four snakes. And that is the reason why our Indian anti-snake venom will be effective for these four snakes. Indian anti-snake venom will be effective for these four snakes. Remember, Indian anti-snake venom is not covering the king cobra. You have common cobra, you have crate, you have Russell's viper, you also have saw-scale viper. Right? Nowadays, the hump-nose viper case also increasing. They call it as big five. Right? But traditionally, these big four snakes are important, for which the Indian anti-snake venom will be very effective. Fine. So let us have a discussion of each snake, how to identify these snakes. Fine. Let's talk about that. You can see this is the king cobra. You can see the king, right? It's also called as, the scientific name of this king cobra is Ophiophagus anna. Ophiophagus means eating snake, right? Snake eating snake. Fine. So it can grow up to 4 meters, 2 to 4 meters. 4 meters it can grow. It is the largest venomous snake in the world. Largest venomous snake in the world. India is a country which is having the highest number of king cobra, but is not present throughout India. You can see the hood. All cobras will have a hood. This, you can see a hood, right, which is flat. This is king cobra, right? The fatal dose of king cobra venom, right, it is 12 milligram. 12 milligram. Okay. Now going forward, the next cobra. This is your common cobra. This is your common cobra. It is naja. Common cobra, that is naja, belongs to Elapid. It is neurotoxic. It can grow only up to 1.5 to 2 meters. How do you differentiate a king cobra from a common cobra? You can look at the hood. The hood will be having a spectacle mark. which is not seen with king cobra, that is only seen with common cobra. You can see a spectacle mark, you can see a monocle mark that will be there with naja, not with your king cobra, not with your Ophiophagus ana. Okay, so that is a way you can differentiate, not by looking at the size alone. Okay, what if baby king cobra comes? Fine. So it's not by the differentiation, is not by the looking at the size of the snake, it is about the hood. Now moving on to the next snake. This is again very, very important. This fellow is a silent killer. I'll tell you why. Right? Is common crate, also called as Bungarus ceruleus. The scientific name is Bungarus ceruleus. This is commonly seen in residential areas because this fellow is fond of eating rodents. Rodents will always be in the residential areas, domestic place, though this fellow will also be in the residential place. This fellow is purely nocturnal. He doesn't come in the daytime, right? He comes only in the night time. And remember, this fellow gives a painless bite without any pain, right? Sometimes the patient does not even be aware of being bitten by a crate. The patient doesn't know that it's a case of snake bite. He will be sleeping in the night. Morning when he tries to wake up, the entire limbs will be paralyzed. He will not be able to walk itself, stand up itself. Right? This fellow gives a painless bite. That's why I told you it's a silent killer. The fatal dose of Bungarus ceruleus is 6 milligram. King cobra, I told you 12 milligram, whereas this crate, it is 6 milligram. Right? 6 milligram is enough to kill a person. Fine. Right, now comes your viper. This is Viperidae, right? This is a viper, we know, right? But what viper it is? This is Russell's viper. How can I say this is Russell viper? Look at the diamond shaped markings on the back. 1, 2 and the 3. You will have 3 rows of diamond shaped markings, 1 on the top, 2 on the sides. And if you can see that middle one, you can see all the diamonds are interconnected. They are touching each other. Okay, they are touching each other. So that is basically Russell's viper. The biological name, scientific name is Dabio russelli. All vipers, you can see a triangular head and a narrow neck. You can see a triangular head and a narrow neck. Vipers. Fine. As I told you, you can see the diamond shaped markings on the back. That is Russell's viper. This fellow is highly irritable. Right? If you see all the snake, viper, Russell's viper particularly is a highly irritable fellow. Now coming to another viper, this is saw scale viper. Saw scale viper. Right? You need to see the scales. Saw scale viper. Fine. And if you look at the scales, it will be like a keel. Right? Serrated edges. Scales will be there in the sides of the body. Right? What it does is, it will coil and rub its own body. When it is rubbing its own body by means of the scale, it will produce some rustling sound. Right? This is basically saw scale viper. Scientific name is Ecnis carinate. Ecnis carinate. Right? So that is the scientific name. Fine. This is hump nose viper, hip nail. That is hump nose viper. How do you identify this? You can see the dark brown patch on the body. 2 rows will be there. Dark brown patch. You can easily identify this fellow is hump nose viper. And this is sea snake. You can see the flat tail. That is sea snake. Okay. Fine. So I've told you about king cobra, I've told you about common cobra, crate. Crate particularly, when you look at the dorsum of the body, you can see something like this. Right? You can see the hexagonal shaped scales. You can see the hexagonal shaped scales will be there. So that is a specific feature of crate. Right? That's a specific feature of crate. Fine. And Russell's viper, I told you, you can see the diamond shaped marking, 3 rows will be there. Saw scale vipers, you can see the serrated edges. Right? Hump nose viper, you can see the dark brown edges. And this is your sea snake. Right? You can easily identify. See, it is very important. It is very important for the management of the patient, because sometimes the patient might not be aware what snake it is. But when you show the photograph, he will be able to identify which snake it is, so that you can easily find out which snake it is and what type of toxicity that you can expect in the patient. If you are talking about the MCQ aspect, in the exam they can give you, patient has come with history of snake bite, he has shown this particular picture and this is the snake which has bitten him. The patient is presenting with all these features. What is the antidote that you want to give? How is the management? Right? How can you manage this patient? Fine. On looking at the image, you need to identify which snake it is. Patient has come with the history of bite to this particular snake, and what is the next line of management. So you should know first of all which snake it is, then you will identify which toxin that you can expect, and based on that you can manage the patient. Okay, so that is very, very important with regard to identification. Sometimes the patient, when he comes to the hospital, he may not be able to identify the snake, but sometimes what the problem is, like he might be bringing the snake itself, sometimes killed, sometimes alive, right? Fine. So it's you that you need to identify, see the snake and identify which species it is, so that you can treat the patient effectively. Okay. So let us have a discussion of venomous apparatus of the snake. See, the venomous gland of the snake is basically the modified salivary gland. We have the salivary gland, right? Likewise, the snake has also got salivary gland that is modified. Venomous gland is the modified salivary gland of the snake. Right? You can see the venomous apparatus, you can see the venomous gland, and you can also see the fangs. Right? You can see the modified venomous gland, that is modified salivary gland, the venomous gland, it is secreting the venom. Through this duct, it is passed into the fang and it is delivered into the tissues. Right? You can see the fang that is coming out. Fine. Whenever the snake wants to bite, whenever it wants to inject the venom, there will be few muscle fibers behind the gland, venomous gland. It will constrict the muscle fibers. That constriction of muscle fiber pushing the venom through the duct and it will be delivered into the system. So you can see this is the venomous gland, and you can see the venom that is coming out, drop of venom that is coming out. Okay. Now, when we talk about the venom, you see, when we talk about the venom, most of the parts of venom, basically they are proteins, enzymes, right? 90% of the venom is basically made of enzymes. They are basically proteins. And what type of proteins? How many proteins that you have got? You have more than 100 proteins that is present, more than 100 enzymes present in the venom of the snake. You have variety of enzyme. Now what happens, because it is enzyme, because it is protein, suppose if it is injected into the body, it can cause envenomation. Right? If it is injected into the tissues. Suppose if this venom, it is taken orally. What happens when it is taken orally? You take a glass of snake venom, king cobra venom, drink it. What will happen? Nothing will happen. It will be digested in the body. Right? It is digested in the body. Nothing else can happen, provided there is no ulcer. Right? There is no ulcer. Fine. Because it is protein, it will be digested in the body. Fine. So basically, it is causing envenomation when it is injected. This type of venom can spread through superficial veins and lymphatics. It spreads through superficial veins and it spreads through lymphatics. Okay. Two things. Predominantly, it is lymphatics, right? Also superficial veins. Now, let us say patient has come for the treatment aspect. He has come to the hospital with history of snake bite. Suppose if the patient does know whether it's a case of suspected snake bite. Right? You don't even know whether he is bitten by snake or not. In case if the patient has got history of snake bite, now the person knows he is been bitten by snake. Fine? He knows that. What happens here? The most common symptom. What is the most common symptom that you can expect in this fellow? That is fear. He'll be extremely frightened. Anxiety, palpitation, everything will be there. You need to calm him down. That is very important step in the management. Okay, reassurance is very important. The most common symptom is fear. Irrespective of whether it is venomous or non-venomous, doesn't matter. If there is history of snake bite, you see most of the times it is non-venomous bite. They say 70% of the time it is non-venomous bite only. Only 30% of the time it is venomous bite. 30% of the time it is venomous bite, 70% it is non-venomous bite. So you don't have to do anything actively, you just have to give psychological reassurance, that should be fine. Suppose if it is a venomous bite, venomous snake, what happens? Even then, right? 50% times what happens, the person does not develop any symptoms at all. There is no symptoms in the person, no symptoms at all. Why? Because just because the snake is biting you, just because it's a king cobra, just because it's a venomous snake that is biting you, that does not mean every time it is injecting the venom. Okay? The snake, particularly the cobra, has got a control of delivering the venom, whether to inject the venom or not. If the snake has bitten but it has not injected the venom, do remember that is called dry bite, which is very, very commonly seen with cobra, that is elapid, because it has got a control. Okay? In case if the venomous snake is there, it has injected the venom, now the patient will have envenomation. Now the patient will have envenomation. Do remember, it is called ophitoxemia. Right? You need to remember this terminology, that is called ophitoxemia. There's one more terminology like that is called ophiology. Ophiology is nothing but study of snake. But this one is ophitoxemia, snake venom envenomation. Envenomation. Now the patient has got envenomation there, patient has got symptoms, you need to treat the patient. Right? This is very important. You need to manage the patient. Now, if the patient is bitten by a venomous snake and the venom has got injected, we get what is called as ophitoxemia. Now, let us see what are the problem the patient can have. Number one, the patient will have what is called as PPS. What is that PPS? It is painful progressive swelling. The patient will have what is called as painful progressive swelling. What happens here? Do remember, basically the patient will have lot of pain in that area. The patient will have pain, local swelling will be there, bleeding will be there, necrosis will be there, local necrosis, fine. Right? The patient will also be having regional lymph node enlargement. That is very, very important. The patient will also be having regional lymph node enlargement, and the patient can also progress into what is called as compartment syndrome. Because of this kind of necrosis and swelling, the patient can progress into compartment syndrome. This is called painful progressive swelling. This kind of local necrosis, remember, this kind of local necrosis is very, very commonly seen with which bite? Viper bite. Right? This is very, very important. This kind of local necrosis is more pronounced in case of viper bite. Viper bite. Okay, now this is one important local aspect. Now moving on to systemic aspect. Systemic aspect, the first important thing is neurotoxic features. Right, which snake has got the neurotoxic feature? Remember, elapids. Elapids will be having the neurotoxic envenomation. We discussed it earlier. So here what happens, see, the patient will be having, you can see the ptosis. One of the early feature, you can say drooping of eyelids. You can see drooping of eyelids, ptosis will be there. The patient will be having drooping of eyelids. The patient will be having diplopia. The patient will be having dysarthria. The patient will be having dysphagia. The patient will be having slurring of speech. The patient will be having all this thing will be there. We call it as descending paralysis. Right? Gradually the paralysis will be descending downwards. The patient will have finally dyspnea. The patient, when he complains of dyspnea, the patient is having respiratory difficulty. That will say the patient is moving on to respiratory failure. Death will be due to respiratory failure. You can remember all these. I told you, drooping of eyelids, diplopia, dysarthria, right? And dyspnea, finally death due to respiratory failure. You need to remember that it is due to respiratory failure. Very, very important. Okay, so this happens with neurotoxic envenomation. When it is neurotoxic envenomation, I told you this is commonly seen with elapid. Now moving on to the next type of toxicity is hemotoxicity. Which kind of snake will be, which kind of family of snakes will be having hemotoxic features? You all know that it is due to viper bite. Fine, viper bite. When it is viper bite, do remember friends, the patient will be having what is called as DIC, disseminated intravascular coagulation. That is one of the most dreadful complication. The patient will be landing up with spontaneous bleeding everywhere. Not dramatic bleeding, spontaneous bleeding everywhere. The patient can land up with shock. The patient can have acute kidney injury. The patient can die. Okay. Which snake? Viper. Do remember, it is viper. It is hemotoxicity. There is one more toxicity that you need to know, that is basically, that is seen with myotoxic snake. Which family of snake is having myotoxicity? Do remember, I told you that is seen with hydropedic, that is sea snake. Here the patient will be having muscle pain. The patient will be having muscle pain, the patient will be having tenderness, the patient will be having swelling of that area. He will have myonecrosis. You can see rhabdomyolysis. Rhabdomyolysis will be there. Patient will be having myoglobinemia, myoglobinuria. Finally, it will result in renal failure. So you need to remember it is myotoxic. It should be fine. Okay, that is associated with sea snakes. Fine. I have told you all the local features. I have also told you the systemic features. What is specifically the reason for all this kind of neurotoxicity and your hemotoxicity? Right, and the local necrosis. See, venom is something where I told you that it has got more than 100 of enzymes are there. But there are few enzymes which are more in case of cobra, which is responsible for this neurotoxicity. There are few enzymes which are more in case of viper bite, which is responsible for the local necrosis. Particularly when you talk about neurotoxicity, you can remember that there is something called Bangara toxin that is responsible for the neurotoxicity of the elapids. Right, you have what is called as Bangara toxin. You also have acetylcholine esterase. But what is so important is Bangara toxin. You have alpha and you have beta. Two types are there. Right, alpha Bangara toxin is seen with krait and beta Bangara toxin is seen with cobra. These are the two important type of Bangara toxin that is responsible for the neuroparalysis. Okay, fine. Now, suppose if the patient is having neurotoxicity, how would you know? How would you know that he is suffering from neurotoxic snake bite? Or how would you assess the prognosis? How would you assess the progression of the symptoms? What you can do is, bedside test number 1, you can do what is called as single breath count. Right? In a single breath, the person has to keep on counting from 1 onwards. 1, 2, 3, 4, 5, 6, 7, 8 like that. He needs to keep on counting it. It will check the respiratory reserve of the person. Right, every 15 minutes you need to repeat it. Right, respiratory reserve. Particularly this is useful in cobra, elapid bite, where you can see the person is not able to count longer. That means the respiratory reserve is coming down, is gradually worsening into paralysis. Okay, this is specifically for elapid. The second important test that you can see is, you can look at the forehead. When you look at the forehead, loss of frowning will be there. That is again a feature of paralysis. Okay, if it comes to viper bite, in viper there is one very important bedside test that you can do, that is called 20 minutes whole blood clotting test. Whole blood clotting test. You can say 20 minutes WBC test. WBC means it's not WBC, right? White blood count, white blood cell. It is whole blood clotting test. What we'll have to do is, do remember, in this particular test, it's a bedside test. You don't have to do any, you don't need any reagent and all. What you have to basically do is, you take test tube, take 5 ml of blood in a test tube. Whole blood in a test tube. What should you do? Don't do anything. You don't have to do anything. Just wait. Keep it away. Keep it aside. Don't even touch it. Don't even disturb it. Wait for 20 minutes. Wait for 20 minutes. After 20 minutes, normally what happens? The blood has to clot. If suppose clotting is there, that means the person is normal, or we can say he might have been bitten by elapid, not viper. Right? But if there is no clotting, that means means that patient is going for DIC. You need to immediately start ASV. Right? You need to immediately start ASV. Fine. So this is 20 minutes whole blood clotting test. You don't have to do anything. You just need a clean test tube. Remember, you need a new test tube. New, clean, glass test tube. Right? You can't use plastic test tube. You need to use a glass test tube. That is very important. Okay? Every time you need to have a new test tube. Fine. So this is very important. Suppose if the patient has already been in the hospital, see which is more important. You have prothrombin time, and INR is more relevant than 20 minutes whole blood clotting test. Right? This is more relevant. right? If the person is in a facility where this PTINR is not able to be done, if there is no lab facility, lab backup for doing this PTINR, then he can go for 20 minutes whole blood clotting test. That will be bedside test to assess the prognosis of the patient, progression of the envenomation. Why there is no clotting? That is because of hypofibrinogenemia, right? Low fibrogen, right? Fibrinogen. That's what you need to remember. Okay, remember, this is one very important test, that is 20 minutes whole blood clotting test. It can be done in the bedside itself. This can be done in the bedside itself. Fine. Suppose I have told you all the symptoms with history of snake bite. But there are very rare situations where the patient himself will not be knowing. There is no history of snake bite. There is no history of snake bite. There is no local finding, no fang mark, right? But the patient presents with palsy, the patient presents with paralysis, the patient presents with abdominal pain. Typical history given by the patient is patient will be sleeping in the floor night time. The next day morning when he wakes up, he is not able to get up. Palsy is there and abdominal pain is there. This is so typical of crate bites. Right? This is so typical of crate bite because the patient will not be having any local symptoms. This is called occult bite. Directly the patient will present with paralysis, which is called as occult bite. Occult bite. So this is called crate bite, which is producing what is called as occult bite, which is very, very commonly seen with crate bite. Okay, so there is no local symptom, only paralysis. Fine. So I have told you the entire thing, the neurotoxic envenomation. Right? I've told you the hemotoxic envenomation. I've told you the local features. I've told you the myotoxicity, how to assess the neurotoxicity lipid, how to assess the hemotoxicity in case of viper bite, 20 minutes whole blood clotting test. I've also told you about the occult bite. Do remember this flowchart. This flowchart is highly, highly important to examine, to assess the progression of envenomation. To know about each and everything in snake bite envenomation, this is one important flowchart that you need to keep in mind. Right? So we know that patient is bitten by snake and these are all the different envenomation things that patient can have. So this is the neuroparalysis that you can see in a patient with cobra bites. Right? You can see the ptosis, bilateral ptosis. Very, very typical. The patient will be moving on to respiratory failure. That is so important. The patient can die of respiratory failure. You can see the intense spontaneous bleeding. In a case of viper bite patient who has developed DIC, I told you spontaneous bleeding will be from everywhere. Epistaxis will be there, hematemesis will be there, melena will be there, right? Gingival bleed will be there. Everywhere there will be bleeding. So that is seen with DIC patient. Okay, so this is 20 minutes whole blood clotting test. I told you need to take blood in a test tube, right? Wait for 20 minutes. If clotting is there, that may be normal or elapid. If clotting is not there, definitely that is viper bite who is moving on to DIC complication. Fine. Let's talk about the management. Right? When we talk about management, there are two aspects that we have to discuss. Number one, it is a first aid approach. Patient has come with snake bite. You need to have first aid approach. You should also be having specific management. Right? We'll discuss both. First aid approach is very, very simple. What is called as carry no right. What is that carry no right? Carry the patient. Don't allow the patient to walk. Because the more the patient walks, faster the venom spreading into the body. Don't allow him to walk completely. You should not allow the patient to walk. No tourniquet. That is very, very important. People, they do tourniquet, ligation and all. You're not supposed to do that. Rather than helping the patient, this kind of tourniquet and ligation, it is doing more harm to the patient. It should never be permitted. No electrotherapy, no cutting, no incision, suction of blood. All these things should not be done. All this will increase the chance of necrosis and further complication of venom spread. Okay, then what can we do? What is RIGHT? R for reassurance. Reassure the patient, calm the patient down. Because I told you the most common symptom is fear, right? So the patient will be having psychological symptoms. Patient will be so anxious, palpitation. Reassure the patient, calm the patient down. Otherwise, even the psychological symptoms itself will maybe killing the patient. So it is very, very important, psychological reassurance. I for immobilize the patient, immobilize the limb. The entire limb has to be immobilized just like you immobilize the fractured limb of the person. Okay, immobilization should be there. Immobilization should be there. GH, get to hospital immediately. Tell the symptoms to doctor, right? So that the doctor can treat the envenomation. This is RIGHT, carry no right. But here, there is one more important thing that we have to know. Here, when we are immobilizing, there is one important technique that is called Sutherland's technique. Right? That is called Sutherland's technique. What is this Sutherland's technique? Fine. So this is basically pressure immobilization technique. Right? Pressure immobilization, right? Or you can say pressure band immobilization technique. What are we supposed to do in this? What are we supposed to do in this? We know already that the limb has to be immobilized. Here, what we are doing extra is we are applying pressure. That's all. We are applying pressure. Let us say this is the limb of the person, right? This is the limb of the person, right? Let us say this is the leg of the person, right? Fine. Here you can have the snake bite, 2 fang marks. Patient has come with the history of fang mark. You can see the leg with the fang mark. What you are supposed to do, you can apply a splint over there. Right? First of all, you need to apply a splint. Then what you have to do is, you need to apply the bandage. Right? You can use bandage or you can use creep bandage also. If creep bandage is not available, sir, what shall I do if there is no creep bandage at that place? You can even apply a cloth. Right? You can apply cloth. Fine. But it should always start from the distal. It should go proximally. The entire limb has to be bandaged. Entire limb has to be bandaged. What is the rationale behind this? The rationale behind this is, you know very well, the venom normally spreads through lymphatics and superficial veins. So this kind of pressure might be reducing the spread of this venom. Right? It might be reducing the spread of the venom. But do remember, there are 2 important cautions that you have to be taking. Number 1, it is not recommended. It is not recommended in viper bite, because you know very well the local necrosis is more with viper bite. This kind of things will increase the chance of complication. Number 2, you should not apply it too tighter. You should not apply it too tighter, so that you will occlude the artery itself. The entire limb will be going for gangrene. You're not supposed to do that. You're not supposed to do that. So that is very, very important. So that's the difference between ligation and this one. Okay. Ligation is something where you apply one ligation. Fine. That should not be done, because it might be causing obstruction of the blood flow to the limb itself. This is just applying pressure. Just applying pressure. Okay. That's it. Nothing more than that. Okay. How would you know that it is reasonable enough? How would you know that it is not occluding the artery? It is occluding only the vein. When you are applying one finger into the bandage, it should be able to enter in. You should be able to insert one finger into the bandage. That is sufficient enough to occlude the lymphatics and superficial veins. So that's how it should be tighter. That is enough. You have specific pressure and all given in this pressure immobilization technique. All this is not so important. Just know this principle, that should be sufficient. You know this principle, that should be sufficient. Fine. Okay. So this is RIGHT, right? Carry no right. Carry no right. Fine. I told you the Sutherland's technique, where you need to apply creep bandage. Pressure immobilization has to be done. Fine. Let's go forward. Now the patient has come to the hospital. You need to give specific treatment. As soon as the patient has come to the hospital, what are you supposed to do? As soon as patient comes to the hospital, don't start immediately giving ASV. Never ever be done like that. Do remember, first you should observe the patient. Clinical observation. Right? You should not give anti-snake venom in each and every snake bite cases. That should not be done. This ASV can be given, anti-snake venom can be given only if there is signs of envenomation. Only when there is sign of envenomation, you have to give this ASV. Otherwise, you should not give ASV. The reason being, the source of anti-snake venom, it is from hyper-immunized horse serum. Right? You immunize the horse with snake venom, you get the antibody, the serum, hyper-immunized horse serum. Since it is from a non-human origin, it has got lot of allergic reactions. It can even cause anaphylaxis. So you should be very, very careful while giving this ASV. Right? You should be very, very careful while giving ASV. You can give this ASV only when there is envenomation. Otherwise, you should never ever be given. You just keep monitoring the patient. That is more than sufficient. Not only for the allergic reactions, even the Anti-snake venom is so precious. It is so precious. You can't afford to waste it. Fine. The patient has got allergic reaction. The patient has got the risk of allergic reactions, anaphylaxis. So can we give test dose? Do remember there is no test dose. You should not give any test dose because giving the test dose itself will pre-sensitize the patient. It may cause increased incidence of anaphylaxis. You're not supposed to do it. It is again a waste of time. Don't give test dose. No test dose. Fine. Right? And do remember this anti-snake venom, it will neutralize only the unbound venom in the body. That is so very important concept that you need to understand. Make a note of this. This is very, very important. Unbound venom. If the venom has already got bound to the tissues, it has already caused reaction, that venom cannot be neutralized. It can neutralize the venom that is unbound. Free venom can be neutralized by this. So that is the reason why you should give the anti-snake venom as early as possible. As early as possible. Right? You can't wait for a longer time. You can't wait for a longer time. Fine. What is the dose that you can give? What is the dose? If you look at the dose, you can give 10 vials IV. Right? Not to give oral, not to give intramuscular, nothing like that. It is only IV, diluted, normal saline, you have to give IV. Fine? That's very, very important. Only IV has to be given. In 100 ml NS, you need to give over a period of 1 hour. 10 vials IV. Fine? Now, suppose you have given ASV, what are the snakes against which it is effective? It will neutralize the venom of what? What are the snakes against which it is effective? Effective against dash. Number 1. It is common cobra. Do remember, it is not king cobra, it is common cobra. Saw-scaled viper. Right? Saw-scaled viper. Fine. Crate. And Russell's viper. Russell's viper. Fine. I've already told you the big four. Right? These are all the big four against which this anti-snake venom will be very, very effective. Fine. You can also remember CSK rocks. Right? C for common cobra, S for saw-scale viper, K for crate, and R for Russell's viper. This is again another mnemonic which you can remember, the big four. Okay, CSK rocks. I told you the dose is 10 vials. It has to be given IV. Fine. Suppose this is the point that you give ASV. And I told you the dose is 10 vials IV. You don't need any kind of, you need to give as early as possible. You don't need to have any kind of dose adjustment. Same dose is given for all the age, for all the sex. Right? Only same dose is enough. Fine? Right. Okay, now you see, you have given this ASV. Reassess the patient. So if it is elapid, reassess the patient after 1 hour. Reassess the patient after 1 hour if it is elapid. If the patient has got worsening of symptoms, right, then you can again repeat the dose of ASV. This is for elapid. Suppose if it is viper, this is for elapid. If for elapid, you can repeat the ASV. For viper, you need to reassess after 6 hours. You need to reassess after 6 hours. How will you reassess? You do again the 20 minutes whole blood clotting test after 6 hours if it is viper bite. Why do you want to wait for 6 hours? Because you need to give some time for the liver to generate the clotting factors. I told you already, whatever damage is already done, it is already done. It is about the time for the clotting factor to regenerate. Because the ASV will be neutralizing only the unbound venom, not the bound venom. Right? Fine. So that is about very, very important point that you have to remember. That's about ASV. Fine. And the next important thing is, suppose you have given ASV and he has got neuroparalysis. Maybe it is a cobra bite. Right? How can you reverse a neuroparalysis? You can give IV neostigmine. Remember, you can give IV neostigmine plus atropine, right? That is to reverse the neuroparalysis. Remember, reversal of neuroparalysis. Right? Just because you give ASV doesn't mean the neuroparalysis will be reversed. For the reversal of neuroparalysis, you have to give neostigmine and atropine. And this will be effective only for cobra bite, not for crate bite. Even though the crate is neurotoxic, it will not be effective for crate bite because the site of action is very different. Okay, let's not go into that detail. You remember, it is effective only for the cobra bite, not for crate bite. Apart from that, you can do dialysis, right? If it is needed, you can do wound debridement. If the patient has got local necrosis, you can do wound debridement. Okay, so all these features are very, very important. You can also give fresh frozen plasma. All these features, all these measures are so very important, right? They are so very, very important in all case of snake bite. That is because I told you again, coming to the same point, ASV will be affecting only on the unbound venom. Whatever damage that is already done that cannot be reversed by anti-snake venom, you have to take care of these measures. In addition to it, just because one snake bite patient has come, you have given ASV, that doesn't mean that's a complete approach. That's not a complete management. You need to give ASV, and other features also have to be taken care of. After the snake bite, we'll be discussing on the scorpion sting. Now it is not scorpion bite, it is scorpion sting. Right? Most of the cases of scorpion sting are accidental. Children are more prone. Children, they have the risk of, right, more complications. Serious toxicity can happen with children. They have the increased risk is there among children. Okay, now when we talk about scorpion sting in India, there are two important scorpions that is so relevant. One is Indian red scorpion. We call it as Mesobuthus tamulus, right? That's a scientific name, Mesobuthus tamulus. Another one is black scorpion, right? Black scorpion, right? You know that is venomous. Fine. You see the nature of venom. The nature of venom from scorpion, it is very, very similar to cobra, right? It is very similar to cobra, but still the fatality is less. That is because the amount of venom, the quantity of venom injected is less, right? When compared to cobra, the nature is same, quality is same. The fatality is less because the amount that is injected is less. That's why fatality is less. It has got both neurotoxin. It has also got vascular toxin, that is hemotoxin. It has got neurotoxin. It has also got hemotoxin. Fine. So that is very important. What does it do? These kind of toxins, scorpion venom, what it does is it will stimulate, right? It will stimulate the sodium channels. This is very important. It is stimulating the sodium channels. At the same time, it will inhibit the potassium channels, right? It is inhibiting the potassium channels. It is stimulating the sodium channels. That is why it is so important to produce what is called as autonomic storm, right? It produces, the scorpion sting envenomation produces what is called as autonomic storm. Let's discuss about that. You can see that these are the two scorpions that I told you. You can see, right? You can see by means of this, it is injecting the venom, right? You will not see two punctured marks. You will see only one mark. Only one mark will be there. That's how you can differentiate whether it's a snake bite or it is a scorpion sting. So let us look at the signs and symptoms. When you look at the signs and symptoms, locally the patient will have severe pain. The patient will be having severe pain. You can see that you need to treat this by giving, you need to give pain relief to the patient. You can give local lignocaine infiltration. You can give ice packs. You can also give NSAIDs, right? That is very, very important for the pain relief. Fine. So this is local pain for the scorpion sting. Fine. Sometimes what happens, patient will be having local pain but no other systemic feature at all. Then it is called as dry bite, just like dry sting. Just like we saw dry bite in case of snake bite, here also sometimes it can be dry, where there is no venom injection, only local bite, local sting will be there. That's only pain will be there, no other things will be there. Fine. Right. Now moving on to cholinergic crisis. What happens? I told you it causes autonomic storm. You get a lot of crises. The first one is cholinergic crisis, the early feature. What happens here? The patient will be having salivation, the patient will be having sweating, the patient will be having priapism, the patient will be having brady, hypotension. All cholinergic features will be there. That's the early feature. That is early feature. Next, the patient will be progressing into adrenergic crisis. That is a late feature wherein the patient will be having tachycardia. Patient will be having hypertension, myocardial dysfunction, cold extremities. Everything will be there. One of the most important complication the patient develops is pulmonary edema. Right? The patient develop pulmonary edema. That is very, very important. Okay? Fine. Or if it is so severe envenomation, the patient can even develop CNS manifestation, patient can develop intracerebral hemorrhage, patient can develop convulsions, it can result in multi-organ failure also. But for all the things, what you have to remember is we have to give ASV, anti-scorpion venom in addition to the prazosin. This is very, very important. Right? Prazosin is a gold standard drug for all this scorpion sting envenomation. Prazosin is very highly helpful here. Okay, prazosin has to be given. Then depending on the other complications, you can treat the patient accordingly. If the patient has got pulmonary edema, you can give dobutamine, you can give sodium nitroprusside, you can give NTG. It depends on the other features the patient has got. Right? So do remember these are the two important combinations that we have to go. If you have anti-scorpion venom, then you can give anti-scorpion venom in addition to this prazosin. Fine? And locally we have to take care of this pain relief by giving lignocaine and if needed, we can give oral pain analgesics as well. Okay. We'll be starting with another interesting topic. This is plant irritant. We just discussed about animal irritant, so we'll be discussing on plant irritant. Do remember, friends, we were discussing about irritant as such. Irritant, we discussed about metallic irritant, non-metallic irritant, animal, and the last one is plant irritant. See, this topic is basically mostly based on image-based questions, right? So you need to identify which plant it is, and based on that, what are the signs and symptoms, and what is the management that we have to take upon, right? So we'll be discussing on this plant irritants. Right, I'll be showing all the list of images. So this is basically image-based discussion. So we'll have it. I hope you remember what are the examples I've told you when I told you the classification. So we have a long list of plant irritants. You have Ricinus, Abrus, Hemicarpus, Croton, Calotropis, Capsicum. You have got a very long list. So let's start with one by one. The first one is basically nothing but your Ricinus communis. Right, so this is basically Ricinus communis. Ricinus communis, you all know the common name is castor plant. So this is basically called castor plant. We can very commonly see this, right? Another common name is arundi, right? It is called castor or arundi. Fine. So if you want to have a look, this is your Ricinus plant, right? This is your Ricinus plant. Remember, every part of the plant is toxic. Every part of the plant is toxic, and seeds are most toxic. Right, you can see it has got serrated leaves. You can see the serrated leaves. Fine, you can easily have a look at it. The fruit of this Ricinus communis will be having small spikes will be there. But do remember, sometimes what happens, the fruit of Ricinus communis might be confused with the fruit of Datura, thorn apple. Fine. See here, the fruit of castor will be smaller, will be soft we can't make out in the image, so it will be smaller and it occurs in clusters. Remember, castor clusters, C for C. Whereas Datura, it will be larger, it is thorn apple larger, and it is solitary, a single fruit. Now coming to Ricinus communis, that is castor. I told you this is your castor plant. Every part of the plant is toxic. You need to have a look at one more important part of this plant, that is seed. Okay, the seeds are most toxic, but do remember how to identify the seeds. When you look at the seeds, it is dark brown in color. You can see this kind of mottling appearance. This kind of marking appearance, the dark brown patches on the seeds, it is very, very important to identify this. And you can also have a look at this, the castor is shiny. You can remember castor oil, right? So oil is shiny, so this is shiny. Fine. But can I take the seed and can I eat it? Can I take the seed and eat it? Yet? You can, provided you are swallowing it without biting it. What does it mean? It means intact seeds are not toxic. Intact seeds are not toxic, but do remember, if it is crushed, it is toxic. Crushed seeds are toxic. Intact seeds are not toxic, crushed seeds are toxic. What happens when you crush a seed? When you crush a seed, you get two things, right? What are the two things that you get? One is oil, another one is residue. Right? You get oil and you get residue. This castor oil, do remember, this castor oil is non-toxic. People use it for cooking and all. Right? We use it for cooking, we use it for purgation, we use it for, they make candle and all from this, right? This castor oil is totally not toxic. But do remember the residue is toxic. because it contains the active principle. You have so many active principles. We'll be discussing on that, right? So what are the important active principles that you get in this resinous communis? Let's talk about that. We have something called active principle, which is also called as toxic principle. Whenever we learn about any plant, we need to know what is active principle or what is a toxic principle, and it is very important for MCQ purposes. Coming to the resinous communis, I told you that it has got active principles. What are the active principles? Resin. Right, we have resin, we have resinolic acid, so we have multiple active principles are there. Even though you have a lot of active principles, which is most important? The most important one is resin. This is the most important active principle. So when they talk about resinous communis, you talk about resin. This resin is highly dangerous. They say it is one of the bioterrorist emission, category B biological weapon. Okay, it causes all the signs and symptoms by inhibiting protein synthesis. It inhibits protein synthesis and it causes all the toxicity, right? Protein synthesis. Fine. Okay. What if the person takes it? When the person takes it orally, see, basically what you need to understand one thing is, remember, it is an irritant. What do you mean by irritant? I hope you remember, irritant means it is inflammation. So what happens when you take it? When you take it orally, what happens? It causes inflammation of the mouth, it causes inflammation of esophagus, stomach. Basically, it causes inflammation. The person can have pain, abdominal pain, vomiting, diarrhea, everything will be there because it causes gastroenteritis. Inflammation, gastroenteritis. Okay, so basically it causes all the symptoms of gastroenteritis. In case you put it on the skin, you take any plant irritant, put it on the skin, it causes inflammation. So basically what you need to understand it, in the whole chapter of plant irritant, depending on the place where you apply, it causes inflammation. That is the one point that is a single point that you need to understand. If you understand it, you'll be able to correlate all the signs and symptoms. Fine. So let's talk about this particular plant, that is resinous communis. I told you that is a biological weapon, category B, and it produces action by inhibiting protein synthesis. Now we'll move on to the next important plant. The next important plant is basically Abrus precatorius. Right? So this is basically Abrus precatorius. Abrus precatorius. Fine? Okay. What are the common names of Abrus precatorius? Abrus precatorius is basically Rati. Right? It is also called a Jecurity. Right? So you have various names of it, common names. Sometimes you get questions on the common names as well. Right? Mostly in the AIMS exam, INSCT exams, you get questions on the common names. Right? So fine. Right. This Abrus precatorius has got one beautiful seed. You have to look at the beautiful seed. Right? It is red in color. Which is egg-shaped or pea-shaped. The tip alone is black in color. That is your Abrus precatorius. It is so beautiful to look at, and do remember, you can see that this is your Abrus precatorius. It has got scarlet red in color. This Abrus precatorius, you have got lot of names are there. What are they? It is also called as Rati seeds. Right? It is also called as Gunchi seeds. It is called rosary beets. It is called crab's eye. So various active principles are there. Doesn't matter. Just know this is Abrus precatorius. The common name is Gunchi or it is Rati. Fine. Egg shape. Scarlet red. It's so beautiful to look at. There should not be any difficulty in identifying this. Fine. Now moving further, look at this active principle. What is the active principle? The active principle is, remember, abrin. This is one of the most important active principle we have got. In addition to this abrin, you also have abrine. We have abralin. We have abric acid. You have so many active principles are there. But what is most important to remember for the exam, you remember that is abrin. That is most important for examination purpose. Okay. Now what do they do with this Abrus precatorius seed? The Rati seeds. What do? They decorticate. They remove the cortex. They decorticate. What they do is they make a powder. Right? They take Abrus. They decorticate. In addition to that, they also add datura. Right? They also add opium. Sometimes they add water. Sometimes they add alcohol. Right? All these things are added. They make a paste out of it. Right? From the paste, they make needle-like structures and they dry it in the sunlight. right? They make needle-like structures. They dry it in the sunlight. Do remember, you get a needle-like something, and this is called as sui needle. Remember the name, it is called sui needle. It is also called as sin needle. Okay, you do have a note of this. This is called sui needle, also called a sin needle. What is the use of this? The sui needle or sin needle, what they take is, they take a long stick. At the end of the stick, they keep these two needles, they beat the cattle. When they beat the cattle, the two needles will be driven into the muscle of the cattle. What happens? Slowly it will start producing inflammation. Because you know very well, this sui needle has got abrus, which will start liberating what? Abrin. Slowly it will cause inflammation. When there is inflammation, the patient will have pain. Right here, the patient is a cattle, right? So the cattle will have pain in that area. That there will be swelling on that area, right? There can be necrosis. There can be regional lymphadenopathy. There can be gangrene, and the cattle will die within 2-3 days. Cattle will die within 2-3 days. Fine. For the owner of the cattle, he is not aware of anything. What he can see is, he can see just 2 puncture marks and the localized necrosis of that area. Right? The total, yes, necrosis for the cattle, 2 puncture marks is there. Cattle will die within 2-3 days. Fine. Right? What would he think of when he can see these 2 punctured marks and the localized necrosis? What can he think of? He would be thinking that the cattle is bitten by a snake. Right? So what we can say is, the sui needle injection, it resembles viperine snake bite. Do underline the word viper. Right? Because just now we discussed, viper is a snake bite wherein we get intense local necrosis. Because we get intense local necrosis in viper, when you look at this particular area, we can say it resembles viperine snake bite. Right? It resembles viperine snake bite. Fine? That is very, very important. And do remember, it is not the ingestion of Abrus precatorius resembling viperine snake bite. That is very important. It is the injection of sui needle that resembles viperine snake bite. That is very important, because many times people think that Abrus resembles viperine snake venom. That's wrong. Right? It is not Abrus ingestion that resembles viperine snake venom. When it is injected, sui needle injection, it looks like a viperine bite. Okay, you need to be very clear with that. Don't ever get confused with that. Right? It resembles viperine snake bite. Cattle will die within few days and you won't have any suspicion. Even the owner will not have any suspicion. Owner of the cattle will not have any suspicion. You call it as ideal cattle poison. You call it as ideal cattle poison. You can also call it as ideal animal poison. It is commonly used as arrow poisoning as well. Right? Not nowadays. In olden days, it was used as arrow poison. Fine. So what I've told you is, I've told you about Abrus precatorius seed. I've told you about the active principle. I've told you about the sin needles, and you need to know that why it is called as ideal cattle poison, also called as arrow poisoning. Fine. Now moving further, we need to go on the next important plant. Before that, I'll show you Abrus precatorius again. This is your Abrus precatorius. You can see the beautiful seed. Sometimes you see the seeds, instead of red, it can also be white. You see, there's one more special point that you need to know, right? Every seed of the Abrus precatorius is having equal weight, 108 milligram. So in olden days, people were using it for weighing and all. If they want to weigh gold or something, they were using it for trading basically. And this is so beautiful to look at. They were using it for ornamental purpose. They were using it for bracelet, necklace and all. They used to have it, right? They used to wear it that. Now, the next important plant irritant is this. That is nothing but your Semicarpus anacardium. Right? Semicarpus anacardium. Semicarpus anacardium. What is this Semicarpus anacardium? This Semicarpus anacardium, this is basically common name of this Semicarpus anacardium is called as Bilava plant. Right? This is called Bilava plant or Semicarpus anacardium. The seed that which you see here, you see it is a dark seed. It is like a heart with a tongue-like projection. You see, this is basically looking like a heart with a tongue-like projection. So easy to find out, and it is larger. You don't get all the other remaining resinous seeds, croton seeds will be smaller. You can see this is so larger. You should not be having any difficulty with that, right? You should not be having any difficulty with that. You can see easily this seed is called as Bilava seed. This seed is called Belava seed. It is also called as marking nut. Right? Why it is called as marking nut? They call it as marking nut. They call it as dobi nut. It is called. See, there it was used mainly by the washermen and all, because what happened? They used to have this seed. They crush the seed. They get a black color juice. They used to make marking on the clothing. They want to identify whose cloth it is, right? So they used to make marking on it. That's why it is called marking nut. That's why it is called marking nut. This is semicarpus anacardium. This is semicarpus anacardium. Look at the seed. This is your seed. When you crush the seed, what happens? When you crush the seed, what happens? You get a black color juice. Right? You get a black color juice. This is very important. You get a black color juice, and people were using it for marking. But some people were using it for marking. Some other people were using it for some other purpose. I'll tell you what. First of all, you need to know that what is a toxic principle in this particular juice. If you talk about the toxic principle, number one, you have what is called as semicarpal. Right? One of your exam question, remember, it is called semicarpal. It is also called as bilavenol. Bilavenol. There should not be any difficulty identifying this, because semicarpus anacardium, semicarpal, bilava plant, it has to be bilavenol. Okay, but don't make a mistake of you telling ricinus, ricin, abrus, abrin, semicarpus, semicarpin. It is not semicarpin, it is semicarpal, right? It is semicarpal, it is bilavenol. That is another important common mistake students usually do. Okay, now what happens? This black color juice, it is highly irritant. It is highly inflammatory. It's an irritant juice. So what happens? Suppose when you put it on the skin, you get painful blisters. You get pain, you get itching, because it causes inflammation, inflammation, itching, you will get blisters. Right? What happens? Somebody consumes it. When a person orally consumes it, the person will have an intense inflammation of GID, vomiting, diarrhea, abdominal pain, everything will be there. Sometimes you can also find the blisters, right? Because of this inflammation. Fine. Now, so this is on the skin. This is on the skin where you can get pain, itching, blisters. Sometimes this blister will rupture. You can even find ulcers on it. Okay. Fine. Some people, I told you, we will use it for marking purposes like washermen and all. Some people will use it for some other purpose with intention. They will apply it on the skin. It looks like blisters. They will use it as artificial bruise. We call it as pseudo bruise. We have already discussed about bruise, right? Bruise is nothing but your contusion. Bruise is nothing but your contusion. But these people will fake the contusion. They will apply the juice on the skin, they develop blisters, they will say somebody has beaten them, and those are the contusions. They'll try to, it's used for malingering, it's faking. But how to differentiate as a doctor, see, when a female has come to you with some kind of blisters in the inner aspect of the thigh, and she is telling that she has got, there was an attempt of rape and she got that injury, she is giving that in this history, how do you know whether the blister is actually a true contusion or artificial contusion? Right? How do you know that? You need to know. Even it was asked in one of your recent exams. Let me tell you the features of artificial bruise. From that you can easily find out what is the feature of true bruise. Right? If you talk about the feature of artificial bruise, what do you think should be the site? Right? If I am applying artificial bruise, if I want to fake illness, where will I apply the juice? I will apply the juice only in the place where it is accessible to me. Right? It will be in the accessible parts of the body. Number one. Right? Number two, you will find intense itching will be there. Because it causes inflammation, you will find intense itching in that area. But in a true contusion, you don't get itching, instead you get pain. Fine. Not only that, you look at the blisters, vesicles. The intense vesication is actually a feature of artificial bruise, not with a true bruise. In a true bruise, there is no blister, there's only a swelling. There's a difference between swelling of the area and a blister. Fine. You cut the blister and see what is inside. What is the content of the blister? You look at the content of the blister will be having what is called as inflammatory fluid, but here it is called as acrid serum. What about the content of your true contusion? What about the content of true contusion? You make a cut in if this is the contusion, you make a cut on that area, what will you find inside? You will find blood inside, you will not find inflammatory fluid. So this is another important point that you need to keep in mind in differentiating a true bruise with an artificial bruise. Right? You have so many other points to be discussed on this. I am not telling you all the theoretical point here. I am telling you what is more important and what is more relevant. Okay? So this is what you need to know. Site, itching, blisters and content. Fine. Right. So this is about your semicarpous anacardium. I told you how to differentiate this semicarpous anacardium, how to identify the seed of semicarpous anacardium. Now moving to the next important plant. This is so beautiful to look at, right? You can see the beautiful ornamental plant. This is your croton, right? Croton. This is called Croton tigelium. What is the common name of Croton tigelium? It is called Jamal Gota. Jamal Gota. The croton seeds. Fine. Or they also call it as Nepala. Fine. So what happens here? You look at this one. This is a seed of croton. This is a seed of croton. Sometimes people they get confused and differentiate. They find it difficult to differentiate between a castor seed and a croton seed. Castor seed is so shiny. You can see markings on the castor seed. You can see these are all the markings. But croton is not like that. It is so dry and uniformly seen. There is no kind of your pigmentation on the seed. So that's why you can easily differentiate. Now when you look at this croton, I told you we have croton. Fine. So this is Croton tigelium. This is Croton tigelium. The active principle is crotin. The active principle is crotin. You have crotonoside crotonic acid. Fine. So though you have active principles, all the three, remember this is the most important one. Most important one. Fine. Crotin. Croton, easy to identify. Fine. Okay. Many times this croton seeds are used for inducing purgation. Right? If you want to induce diarrhea for somebody, yeah, people use this croton seeds. Right? They crush it, they mix it with some drink, they give it to the person will have diarrhea. Fine. And remember the croton seeds. Remember the croton seeds, when you crush, you get oil and you also get residue, which is toxic. Both are toxic. Right? Croton seed is also toxic. Croton oil is also toxic. Both are toxic. Fine. Right. Moving further, let's talk about your next plant. That is your Calotropis. Calotropis. Very, very commonly you can see it on the roadside. This is one plant that you should not be having any kind of difficulty in identifying it. Right? Obviously all the plant. Even more for this Calotropis. Right? Let's talk about Calotropis. See, Calotropis. We have Calotropis. I'm not talking about the species. We have Calotropis gigantea. We have Calotropis procera. You have lot of species are there, but doesn't matter. Just leave it. You just remember Calotropis is more than sufficient. Now, every part of the plant is toxic. Every part of the plant is toxic. All parts are toxic. Right? The root, the stem, the leaf, the flower, the juice, each and every part is toxic. What about the active principle? The active principle of Calotropis. The active principle of Calotropis is calotropin. Calotropin. Calotoxin. Calotoxin. Calactin. Right? Calactin. So you have calotropin, calotoxin, calactin. Fine. In addition to that, sometime you have what is called as gigantin. If it is Calotropis gigantea, you also have usharin. Right? These are the additional active principles that you can think of. But the most important one is calotropin, calotoxin, calactin. So easy to identify. See, Calotropis, since every part of the plant is toxic, every part is used in some other form. It is used in so many other ways. Right? People apply it on the eye. They have this conjunctivitis. They used to use it for malingering. You apply it on the skin, you develop blisters, you get inflammation. People use it for artificial bruise. Fine. They take a twig of this Calotropis, they insert it into the genital tract of pregnant female. It is to procure criminal abortion. Right? They use this juice of this Calotropis, they give it to female infant. It is used for female infanticide or infanticide. It is used in all the ways. So you can think that it is used for abortion, is used as abortion stick. For procuring criminal abortion, it is used for infanticide. It is used for malingering, that is artificial bruise. Right? It is used for conjunctivitis. It is also used for cattle poisoning. Right? You name it, we have it. Right? It's because every part of the plant is toxic. Fine? Calotropis. This is your chili. Is chili toxic or not? Do remember I told you earlier when I was telling you about classification, right? everything that is edible is toxic, everything that is edible is poisonous except for its dose. If you take the chili seed powder, everything in a limited quantity, that is okay, that is edible. If you take in larger quantity, you imagine that you take a bowl of chili powder, have everything, then it becomes highly poisonous, highly toxic. What do you get when you eat lot of chili powder? Fire, burning sensation. Okay, so you get all these things in all the orifices. Fine. So moving on to this, let's discuss about this capsicum. This is chili capsicum annum. Chili capsicum annum. Okay, fine. So let's discuss about that. I told you chili seed is there, chili is there. What is the most important active principle? The most important active principle is capsaicin. We have one more active principle that is called capsaicin. Capsaicin. This is again very important. Very important. Where do people use this? People, they use this. What is the medico-legal importance? Where do people use this? Number one, the seeds of this chili. Seeds of the chili will resemble datura seed. We discussed it earlier, right? Datura seed. Fine. That is the reason why sometimes instead of thinking it is chili, they will eat datura seed, and people might have accidental poisoning of datura. I'll be telling you how to differentiate a chili and datura. For now, you remember it mimics datura seed, right? It mimics that. Now, the next thing is people use it as stupefying agent. People use it for facilitating robbery. They'll throw the chili powder on the face, they'll try to rob. Not only that, it is also used for torture. If you want to torture somebody, you apply chili powder, right? Wherever you want to apply, you can apply chili powder. It will cause burning, fire, sensation, right? Torture. There is one popular method. There was one popular method that is called Hyderabad Goli, right? It is a form of torture methods. What they'll do is, right, they'll make the victim bend. They'll take a lathi or iron rod. They'll cover the end of the lathi with a cloth. They'll smear it into the chili powder. They slowly insert it into the anus of the victim. Okay, so that is called Hyderabad Goli. It's a form of torture. So the next condition that you have to know, that is called Unan's hand. Unan's hand, right? Where it is also called as chili willy. Right? What is a chili willy? Suppose a person who is working in a pickle manufacturing company. Every day he keeps on touching the chili powder, right? Prolonged contact with the chili powder. What happens? This person will develop contact dermatitis. This fellow will develop contact dermatitis to chili powder. Contact dermatitis to chili powder, that is called Unan's hand. He can have painful lesions on the hand. This is called Unan's hand, also called as chili willy, right? People use this chili powder, right, for robbery. I told you, for torture I told you. Sometimes they use it for infidelity. For if they want to punish for infidelity, they use a chili powder. Okay, they'll apply it on the genitalia. Fine. So there are various medico-legal importances for chili powder. So this is your Unan's hand, which was asked in one of your INI-CET exam, AIMS exam earlier. Fine. So this is your capsicum. Have a look at the capsicum. So as I told you earlier, all these plants will have the inflammation symptoms, irritant symptoms, depending on the site where used. Maybe on the eye conjunctivitis, maybe on the skin, inflammation of skin, and when the person is ingesting it, it will cause inflammation of the GAT. When it is injected into the muscle, injected into the tissue, it causes local necrosis. Right? You think of sewing needles, what I've told you. Fine. Now there is one more thing that we have to remember. We have to learn. This is your cantharides. This is your cantharides. Fine. What is this? This is your Spanish fly, also called as cantharides. Spanish fly, also called as cantharides, which is also called as blister beetle. Right. So this is basically Spanish fly. Spanish fly, also called as blister beetle. Blister beetle. Technically speaking, it is not a plant irritant. It should have been discussed under animal irritant. But for continuation purpose, we are discussing it here. This is Spanish fly and your blister beetle. It is also called as cantharides. You have so many names of it. Cantharides. What is it used? The active principle of this, the body contains cantharidin. The active principle of this, it is cantharidin. It is cantharidin. Fine. Every fly will be having 0.2 to 0.7 milligram of cantharidin. Every insect, right? They will catch it, kill it, dry it, right? And they use it for multiple purposes. For multiple purposes, before it's commonly used as aphrodisiac. Aphrodisiac. Right? Love filter. Right? We'll be seeing what is love filter. Okay, this is one of the love filter. Okay, right, fine. So now what happens? Suppose if you use it as a love filter, aphrodisiac, what is the problem that a person can have? Basically, this is an irritant. Is it not? This is an irritant. So what happens? If you apply it on the skin, it causes irritant symptoms, inflammation, redness and blisters. Redness and blisters. And that is the reason why this blister, sometimes people use it as artificial bruise. Again, the same thing. Fine. Now, suppose if the person takes it orally, the person will have all the gastroenteritic feature. The patient will have pain, vomiting, diarrhea, everything will be there. All gastroenteritis feature will be there. That is again important. It's all like you need to apply your common sense. I told you inflammation, you can apply it for anything. But what is so special, what is so unique is, remember, people use it as aphrodisiac. I told you, right? If it is used for aphrodisiac, because it will also, they think that it is increasing the libido. But what happens is, some people might develop what is called as priapism. Painful penile erection. And sometimes this is basically, it's a nephrotoxic agent. What happens? The patient will have loin pain, which is so typical. The patient will have loin pain. The patient can also present with hematuria. Sometimes frank hematuria can be there. The patient will land up with renal failure as well. So do remember, this is very important. When we talk about this cantharides, I told you it is an irritant. So think what happens on the skin, what happens the GIT. If it is absorbed, it causes renal toxicity. Patient will have severe bleeding, right? Hematuria will be there, and sometimes priapism will also be there. So this is about the plant irritants that we have to learn. I would like you to know some other extra point regarding the fatal dose, right? Regarding the seeds. You talk about Abrus precatorius, croton, Ricinus communis, semicarpus, anacardium. What you can notice is, you can observe that I have arranged in an alphabetical order. I have arranged that in an alphabetical order. Forget about calotropis, because we are not talking about seeds of calotropis. I have just arranged the remaining things. You can talk about Abrus, croton, Ricinus, semicarpus. Abrus is 1 seed is enough to kill a person. Croton, 5 seeds enough to kill a person. This Ricinus, 5 to 10 seeds. Whereas it is semicarpus, anacardium, again it is 5 to 10 gram of the semicarpus anacardium. Those are the fatal dose. Usually they don't ask this in the examination, but this is for your understanding purposes, how toxic it is. Fine. There is one more important they can ask you. There is something called toxalbumin. What do you mean by toxalbumin? We have already seen about toxin in the general toxicology, right? Toxalbumin, there are 3 things which are considered here. One is A, another one is C, another one is R. A for abrin, C for crotin, and R for ricin. These are the 3 important toxalbumin which can cause hemagglutination. Hemagglutination. So just know this is your toxalbumin, also called as phytotoxin. Okay, fine. So that concludes our forensic fast forward with animal irritant and plant irritant.